Hi, my name is Kyle Kiesel, and I'm happy to be here to share some research information with you regarding the functional movement screen as the screen fits into the entire injury prevention system we call functional movement systems. So this is a research update with a focus on the functional movement screen. First question we have to ask when we look at research related to injury prevention and injury prediction is, what happens to movement after an injury? That's a big question because things change substantially after injury. So I put together just a few research slides that helps us to understand the motor control change that occurs after an injury. We put together a very simple schematic to help you understand that this is not too difficult on some levels, but from a motor perspective, it is a very complex and sort of a new idea that motor control actually changes. We have an injury or we have pain. Either one could come first, we really don't know. It's just a real nice academic debate to get into, but when you have an athlete in front of you, it's not that relevant which one came first. We have to understand that both of those things affect motor control in an adverse way. And again, we'll look at a few studies that will show us sort of how that happens. These are just a couple of research articles about it. We've got hundreds of references that would really support the idea that movement changes related to injury and pain. Let's look at risk factors to start so we can take a broader view and we'll go from there. As all of you know, if we look at research and injury risk, the most robust risk factor is previous injury. And that's one that's talked about a lot. We'll come back to that in just a second. A couple things we like to look at as well are common asymmetries. These studies, 8 different prospective studies, showed us that there are a variety of different asymmetries that are associated with injury risk. Could be muscle imbalance, could be dynamic balance, dynamic control, or muscle asymmetries in movement. Balance and motor control is a newer area where we have new technology, force plates, EMG, and motion analysis to capture different constructs of movement and balance. And so those studies tend to get named differently, and there's a lot of different ways to talk about that. We've just captured that in balance and motor control. And then we know BMI is a risk factor for injury as well. This is just a great quote in terms of supporting the idea and proving the idea from an epidemiology standpoint that previous injury is the most robust risk factor in sport. And this is relative to football, or in America what we can consider soccer. 70 teams, 18 countries, 9,000 injuries, measuring as many things as we can. Previous injury is the strongest predictor for future injury. And from an epidemiology standpoint, there's really nothing we can do. It would be considered a non-modifiable risk factor. That makes us start to wonder a little bit and question what we're doing, and let's think about it a little harder. Can we actually do something with that? Do we need an injury prevention program? Do we need to throw a program approach at people and hope that things work out? Or the way we want to introduce it today and talk about it in a bigger picture is, do we need an injury prevention system? Important that we look at a system versus a program, and we're going to spend a lot of time talking about that from various aspects throughout our information today. Functional movement systems driven around the book that Gray Cook has published known as Movement, called Movement. We've got the functional movement screen, that's the screening component. We've got the selective functional movement assessment, which is the way we integrate movement into rehabilitation for those that have pain. And we have the Y-balance test, upper and lower quarter ways to measure dynamic movement. We're going to focus on the research today on the FMS, and there are other information available to get more research on the Y-balance and more details about the SFMA. First of all, when we talk about research, we got to talk about reliability. One of the very first things people are going to ask you, is the test reliable? Meaning, can we get the same results when I do the test, when you do the test, or if I repeat the test a couple of times? And for the functional movement screen, the answer is yes. It's a very reliable test. We've had this published in the Journal of Strength and Conditioning Research in early 2010, showed kappa results for each of the 7 components of the movement screen from excellent to perfect agreement, 0.8 to 1 on that kappa statistic. And we've also shown our new research scoring scale, it's a 100-point scale for the FMS, that is reliable with ICC values of over 0.9. The first study we did was an NFL study. We took the functional movement screen composite scores of players at the start of one season, and we looked out how they did over the course of one full season. And our injury definition for this study was membership on the injured reserve. And what we found here was really the first look at the movement screen in terms of injury prediction. And this is where that cut score of 14 or below was first determined. So What we found in this study was if a player scored 14 or below on the FMS, they were more likely to be injured. Now that number has been thrown a lot around in a lot of populations, but what I want you to understand with this is this was a statistical procedure that was driven to determine the number. We just didn't grab it out of the air. It was done through a process known as a receiver-operator characteristic curve, statistical thing. We can get into that later if you want. Send me an email, give me a call. But the bottom line is statistically we determined that 14 was the cut point in this one particular study. And subsequently we found out that that cut score has held up, and we'll talk about that soon. What we showed here was the results of looking at this from a sensitivity and specificity standpoint, or a diagnostic test standpoint. We showed that the screen was highly specific, specificity of over 0.9, meaning it's good to rule in a potential injury if you flunk the screen, if you're positive on the test, if you will. And it shifted your pre to post-test probability of having injury from 15%, about the chance of anybody getting on the injury reserve just because they're on the team, to 51%, and that's those that have actually flunked the test. That was a small study. It had wide confidence intervals. It was really essentially pilot data, and we knew that going in, and now we're able to look at larger sample sizes. So here is a study that we've put together that looks at 3 different teams across the preseason. When we start with the preseason camp, we're able to get a larger sample size. So we had one team for 1 year with 81 subjects, and then 2 other teams across 2 different years with 75 and 76 subjects, giving us a total sample of 232. We applied some standard statistics to this, and we'll run through the results of what we found. First of all, we found that there was a significant difference in FMS scores between those that were injured and those that were not injured. We found that those scoring 14 or below on the movement screen had about a 2-fold risk for injury over the 6 weeks or 8 weeks of the camp, of the entire preseason. And for this study, it's important that we look at the injury definition. The injury definition is a very contemporary way to look at injury, to define injury, and that is time loss. So if a player missed any time due to musculoskeletal injury, they were considered injured for this study. And with a large sample size at a relative risk of about almost 2, we got a tight confidence interval of 1.2 to 2.96. Next, if a player had at least one asymmetry on the movement screen, they were almost 2 times more likely to be injured as well. Again, a nice tight confidence interval, meaning we're pretty comfortable with these data. And the last thing, we always looked for the sensitivity and specificity, and once again, scoring low on the movement screen, 14 or below, was highly specific for injury. Next, we looked at if applying the model, looking at improving one's functional movement based on our model, does that help reduce injury? So this study, again, looked at 2 consecutive seasons looking at training camp, and we examined the data to see if this newly adopted program, improving the players' movement, actually helped reduce injuries. And what we found was there was a significant increase in movement screen scores from year 1 to year 2 when the program was adopted. And the big number here was we saw a 33% reduction in injuries and missed practice days from year 1 to year 2. So simply doing a fundamental movement pattern approach, individual program to help people move better, help reduce injuries. Additional data we found, we were able to decrease the less severe injuries. So significantly smaller or less number of less severe injuries. So the nagging injuries that keep people out, a little bit of movement program has made a difference. And these data showed actually an increase in more severe injuries. So, nothing's everything, and injury is multifactorial, but we do feel comfortable applying this program will help reduce injuries, and in this sample it was all NFL players. So the take home is the results suggest that increasing your FMS score can improve your injury risk. This study was just published, and it is on female college athletes, published in North American Journal of Sports Physical Therapy. And it looked at 38 college athletes from a couple different sports and basically compared their movement screen scores from the injured group and the non-injured group. It's a reasonably well done study, a little smaller sample size than we like to see, but again, it gets us started with those pilot data to look at these different samples. There were 18 total injuries during the study. Scoring 14 or less on the screen was significantly associated with injuries, and 70% of those that scored below the cut score were injured. So again, speaking to that FMS, flunking the FMS or getting below the cut score on the FMS is predictive of injury. Odds ratio for this study was 3.8. That tells us about a 3, almost a 4-fold increase injury risk. Again, smaller sample size, you're going to get a little higher number. And what we showed in our NFL data was the Odds ratio and confidence intervals, odds ratio goes down, confidence intervals tighten up when we get a larger sample. Again, highly specific, 0.75 for ruling in injury risk. And then just a significant correlation between scoring low, and that's no surprise. So the take-home or results from this one, compensatory movement, based on how we measure the movement screen, is a risk factor for female collegiate athletes. Another data set we have from firefighters, changing populations. This was looking at their movement screen score going into a 16-week training program, their academy program. So we screened all the folks going into this program, and we did the same procedure applying that receiver-operator characteristic curve. And we found a very similar result. In the firefighters, 13 was the cut point on the movement screen score to rule in that injury. Again, below the threshold was highly specific, 0.82 for ruling in injury. This case, an odds ratio about 7, but a wide confidence interval, smaller sample size. So again, good pilot data for us to move forward with some larger studies. Another study that showed that 14 or below is associated with predicting failure in those going through a Air Force pararescue training program, similar high-level military type program. Large military study that's coming out soon. Just got one slide on this. Over 900 subjects, again showing if you score below the threshold of 14 or below, you're more likely to fail the program due to injury. In this case, fourfold increase or fourfold chance of failing the program due to injury if you were below the cut score. Here's a study we did looking at truly what happens when we intervene with a sample of NFL players. So we had 62 players who had not been screened before, screened them all in the beginning, and then we applied our standardized, individualized program so that people got these movement corrective exercises based on the algorithm driven from their movement screen score. So we had pre-post tests after results after the 7-week program. And you got to remember this pattern of the way that we identify the corrections are based on that individual score, and not just their total score, but how they score on each of the tests. So we start with the basic mobility. We're going to fix that straight leg raise. We're going to fix that shoulder first. Then we're going to go to the core, work on the core, and then we're going to go to the higher level patterns. So it's not as simple as if the squat is out, we're going to fix it. We're going to look at how all the tests interact, and that's the whole idea of the algorithm, if you will, to correct these movement patterns. It's movement prep, doing stick work, knocking out trigger points, and some isolated flexibility. And what we found is based on that composite score relative to risk reduction, so we want to see if we can move people from below 14 to above 14, and we had 32 subjects that improved their score above the threshold. We had 23 that failed to improve beyond the threshold, and so we've looked into that and we've worked on the algorithm to figure out, all right, we got most of the people, what about those few that lingered? Did they start lower? Did they have a consistent finding? Were they scoring lower on a particular test? Or was there something else going on within that group? In terms of those that already were above the threshold, there's just 7 players that were above the threshold going in. Asymmetries, again, we said asymmetry on a movement screen is a risk factor. We had half of the subjects that had at least one asymmetry going in. After the program, there were only 20 players left with asymmetry. So again, significant improvement and change in terms of injury risk, but we still had a little bit of work to do. Overall composite score, we showed that there were no difference based on which group you're in. Both groups improved. So you can count on about a 3-point change in your composite score regardless of what group you're in. In this case, we grouped the NFL players in a lineman and a non-lineman group. We've heard that from strength coaches and athletic trainers that have used the screen over the years. They see about a 3-point improvement on average, and that's exactly what we found in our study. Interesting when we look at each of the individual tests. In short, the most of the change or substantial amount of the change occurred in the core test. The trunk stability push-up went up dramatically. The rotary stability went up dramatically in these folks. So by applying the model, looking at their basic mobility first, then going to core function, then going to higher level squat, lunge, and hurdle step, we were able to make these changes. And we're not making NFL players stronger on the push-up. We're basically freeing up their core, allowing them to move better and be more efficient. So research summary to close this up. Here's what you got to know. The cut score for the FMS, that threshold score, was not a guess, it was statistically driven. Scoring below the cut score, you have a 2 to 3 times greater chance of injury depending on the population. The presence of at least one asymmetry on the movement screen increases your risk by approximately 2-fold. The cut score is held up in multiple populations, including professional football, female college athletes, firefighters, and multiple military populations. There's more data coming out. We've got lots of studies going on, and there'll be other populations proven, I'm sure, in the future. And the intervention study, following the corrective strategies as outlined by functionalmovement.com, so the algorithm that's available on their site, has been shown to improve the FMS score by an average of 3 points. So it's a systematic approach. If you don't have the book, get the book, read the book. You're going to hear that message from all of us here on out. Okay? Functional movement systems, it takes it all. Today we were talking about research behind the FMS. Look for more information on the SFMA and the Y-balance test, and what we always try to do is keep things as simple as possible. Thanks.